Welcome to the broadcast. You're listening to Knife After Death with Dr. Darren Wolf.
Say, did you ever hear the saxophone let out an awful moan, let out an awful groan? It makes you feel so nervous, yet it's great.
We are back. Have a little bit of delay between our last episode and this one, and I want to explain why. It's not because we're lazy. It's because I got a respiratory infection, an upper respiratory infection, right at the end of December. And I usually don't share kind of like medical details. Who wants to hear that? But the fact is, I have been coughing for literally 3 weeks now, and it's hard to record podcast stuff if you are coughing. And I still am coughing. So I have a mute button on my mic. And if I kind of cut out for a second, that's because I'm coughing. So, but I've also got some water here. This is water. It's not vodka, but it is a clear liquid.
We are being
I
sponsored by
don't, I
Hall's
don't,
cough drops today.
yeah, we are being sponsored by Hall's cough drops. And so if Hall's wants to call me up and sponsor this, please let me know. That reminds me, when I sometimes have people message me and they say, I don't think you would approve of some of the ads that's on your, when people watch this on YouTube, or maybe there's the ads that when they listen to it on their podcast, and I have zero control over that. I just want to say I don't have any sponsors. I welcome sponsors. If anybody wants to come and sponsor this podcast, please contact us. But I have no sponsors. And so what happens is whether it's the podcast host or it's and by host, I don't mean us. I mean the actual mechanism by which it's distributed, or YouTube, they pick the ads. So people have told me, oh, there's all this political stuff. And I'm like, hey, listen, it's definitely not me choosing those ads. I will let you know if I have a sponsor. But if you see something or hear something, you don't need to message us. We have no idea what the ads are.
Yeah,
And that's just the nature of, yeah.
Yeah, just so you know, people can decide if they want to run an ad on our show. Like they can target us, but we actually can't do anything about it. So, I mean, and it happens like with, I mean, one of my favorite political shows is The Majority Report. Other dissenting shows will run ads on their YouTube videos too, and it's just like, I mean, we have no control over it. So just
Well, I first found this out when, right after Charlie Kirk was shot, I made a video detailing the forensic elements of that. Like, it's a high power rifle and stuff. And I made this video and it did really well. But then I got all these messages telling me that, oh, by the way, you're running all these Trump ads on your podcast. Do you know that? And it's like, I can't control that. People who are interested in Charlie Kirk are also probably going to be interested in Republican politics, and that's why YouTube is running those ads because those are the people watching it.
mhm.
So that's just a minor detail I wanted to throw in for everyone. You don't have to worry. I do not choose the ads, but if we get a sponsor or sponsors, we will definitely let you know who is sponsoring. And but yeah, so let's just move on to the to the podcast. And so the one thing we like to do is we like to address uh, comments or questions that are left regarding our previous podcast. We did a podcast, the last one on Ellen Greenberg, which is a very popular quote unquote true crime case, even though there's no actual crime in that case, from 2011. And it's been going on for 14 years now, hotly debated. So most of the comments I received were very positive. They were glad to hear the forensic elements. There were a couple of people that kind of, don't agree, which I totally understand because if you watch or listen to documentaries on this, they always slant it toward murder because if it's not murder, it's not interesting. Um, and I want to add to this that one of the things that I essentially proved, and by the other pathologists proved as well, is that this woman clearly could have committed all these wounds herself. And that's the key. There wasn't any wound on her body that she couldn't have done herself. Well, we were talking about it, about how unusual that is. And and it is quite unusual. don't get me wrong, but about a week after I finished that podcast, or that we finished that podcast, I had an autopsy, which I can't get into the details of, but let's say it was pretty similar to that case. Now, it's not, not as much in terms of the circumstantial, but in terms of the wounds. And for the first time in my career, I had a case where somebody did end their own life with a knife, and wounds were to the back of the body. They were also to the front of the body. But I just couldn't believe it. Honestly, I was stunned because I had done thousands of autopsies and not seen one like that. I've seen lots of sharp force autopsies where people have taken their own life. But to actually have wounds to the back of the body, it just reaffirmed what we talked about in the podcast, which is it's completely possible when people are in that last few minutes of life and they've decided to do it, they can put that knife or whatever implement they're using pretty much anywhere they can reach. So I just wanted to address that to say that yes, those cases are rare, but they're not so rare that you never see them. Is there anything that you want to address on that, Jesse, in terms of comments or questions or
Yeah,
phenomena?
only really to say yes, we've seen that the FBI has stepped into the Ellen Greenberg case. There was a couple people like on our YouTube channel like leaving like, "Oh, I'm so glad the FBI is involved now." And my thought when I read that was, "Yeah, great." I have no dog in this fight.
Yeah,
I
yeah.
just I don't
So
understand.
yeah, because yeah, neither of us are trying to say that we are correct and boohoo, you guys are wrong. The fact is, the evidence is the evidence. All of the qualified forensic pathologists that have looked at that case have come to the same conclusion. The FBI will, if they want to reopen the case, by all means, go right ahead, and they will arrive at the exact same conclusion. When you get forensics involved, especially forensic pathologists that are actually qualified and intelligent, not ones who are just trying to get on TV and saying inflammatory things. Real, actual qualified forensic pathologists will always come to the same conclusion on that case. So FBI, knock yourselves out. You're going to come to the same conclusion that we did and that everybody did before us. So I welcome it. I can't wait to see the report, and we'll do a follow-up podcast. And I will simply say, yes, look, see, we were right on that. And it's not that we were right. It's just that the evidence is the evidence. It's like adding two plus two,
Yeah, and it's just
except
like
it's not quite as easy as two plus two. Yeah, that was a difficult case for
yeah,
sure.
and I want to live in a fact-based reality, you know? So I just whatever the
Yeah.
facts are, like whatever the outcome is based on what is available and what is factual, that's that's how you're supposed to do
Well,
this. So
and I'm only going to make one more comment on this, and then we're going to get on to today's episode, which is a pretty interesting little case. Um, the one thing I want to say about this is when I've noticed people who are still in the conspiracy realm with that case or with any case that is in true crime, is that you can have 150 pieces of data that point to one conclusion, but they will obsess over a one minor point that makes them go, aha, well, if that's not correct, then it must be a conspiracy, it must be a murder, that sort of thing. And the only thing I can compare it to is like mathematics. If you've got, let's say, a multivariable calculus math equation, and there are multiple variables, but you can solve for them and you can come to one conclusion. All mathematicians will come to the same conclusion on that problem. But the conspiracy person will bring it up as a conspiracy based on the type of paper it was written on. You know what I mean? It has nothing to do with the actual solution, but they will focus on something like, aha, well, this paper wasn't ethically sourced, and therefore, Jeffrey Epstein's involved or whatever. So it's so I tire of that, but that's why we do this podcast and that's why I do my social media stuff, is that there are some problems that have multiple solutions, but there are many problems that have one solution. And that's all I want to say on that. Today, we're going to go ahead and get started on this case because I don't know how long my voice can hold up. By the way, I just want to say I feel totally fine. I did not have COVID, influenza, RSV, or anything unusual. I just had an upper respiratory infection and I have a lingering cough. So we're going to see how I do. So today we are going to talk about a topic, and that is Ludwig von Beethoven. Okay, we all know that name. Everybody knows that name. You don't have to be educated to know who Beethoven is, one of the most famous musicians of all time. This is a topic I've been wanting to cover for a couple of years, and I just haven't gotten around to it. And finally, we're going to do it. This man was a very sick man. He everybody knows Beethoven was deaf. And of course, now as I'm online, I see that there are conspiracy theorists that think that it was all a lie and he wasn't deaf. But when you read the history and you read the papers, this man was suffering, and he absolutely was deaf. So. Please don't comment on this video if you're saying that Beethoven wasn't deaf. This is a man who understood music so well, he didn't need to hear it to write it. He knew what it would sound like because he could hear it in his head. Um, and it's almost like a mathematician who can solve equations in their head. They don't need to write it on a piece of paper. They can see the answer. Well, that's how Beethoven and Mozart, people like that were. They were geniuses. But this man was sick, and I mean, really a lot of medical conditions. So, Jesse, can you give us like a little background on this incredible man?
Absolutely. So he was born in Bonn, Germany in let's see, December 17th, 1770. He passed away March 26th, 1827 in Vienna, Austria, at the age of 56 years old. He was young. And a lot, so he had Paget's disease, which is a bone remodeling disorder that can affect both the skull and the cochlea, which is probably had a lot to do with the hearing loss. But I mean, and he was self-medicating because of all of like the pain that he was in. So his actual cause of death was terminal cirrhosis with chronic pancreatitis, with like, I mean, a host of a bunch of other ailments.
So some of the theories and basically the underlying element of all of these theories is that they are multi-system disorders. So these are things that when you have them, they can affect multiple bodily systems. So for instance,
Mm-hmm.
chronic alcoholism. Chronic alcoholism is going to affect the brain, it can affect the heart, it can affect the liver, it can affect the pancreas, so on and so on. Now, it was proven also that this man had a lot of lead in his system. And we're going to talk about why this man may have had lead poisoning. That's also a multi-system disorder. People have theorized the tertiary syphilis, and they theorize the Paget's disease of bone because all of these don't just affect one area, they affect multiple areas. And I'll tell you, as an autopsy pathologist, this kind of case is actually a nightmare to solve. I can tell you that if Beethoven were alive today and I was doing this case, this would be a difficult case to come up with the cause of death because there are so many bodily systems affected. These are similar cases to what I have when I do my hospital autopsies. With forensic autopsy, a lot of times there is just one obvious cause of death. With hospital autopsies, these are people who are very sick, and he would have been a very difficult hospital autopsy. One of the things I want to start with is talking about the deafness. Now, Beethoven wasn't always deaf. I think that maybe some of the people who don't believe in the deafness thing think that he was deaf from birth, so how could he have produced all of these symphonies? And the answer is he was not deaf from birth. This man could hear, but he started to go deaf in his 20s. And the I saw, let's see if I can find it in my notes here. He started to they basically could not figure out why. And he started to describe it to his doctors and to his family. And he had 3 years in his kind of mid 20s. He had 3 years of what was called bilateral hypoacusis, which means he simply can't hear high frequency sounds. And so, obviously, if you're producing music for instruments, there's a lot of high instruments with high pitch, like a violin, piano, piccolo was the ones that he personally complained about. And he was also, as this progressed, he had and I'm quoting this from the paper, which was from the Gastroenterology Mexican Gastroenterology Journal, which was we'll put that in the show notes. That was actually an excellent paper. And it said that he also had unbearable tinnitus. Okay. Other people pronounce that tinnitus. In other words, ringing in the ears. I personally, just as a side note, do not like to pronounce that word tinnitus because when you hear itis, you think inflammation,
Yeah.
and it's not necessarily inflammation. I call it tinnitus, but I'm not an ENT either. So he had this really horrible ringing in his ears, which, if you think about it, that must have been absolutely horrible back when he was living in the 1800s. Because today, if you have ringing in the ears, it is annoying, but you can put on headphones, you can put on music in your headphones or AirPods. You can have turn on white noise and maybe kind of drown it out a little bit. Back then, you really didn't have anything that you could use to drown that sound out constantly. So it's understandable why he was of kind of a. They said he was emotionally labile. He would get very upset. He was isolated. He even had suicidal ideation. So he this drove him so nuts, and that is not an uncommon thing for somebody who has a lot of tinnitus. They
I
can get really despondent.
actually have a quote from the Heiligenstadt Testament that he wrote, which was, I think, it started out as a letter to two of his brothers, and then kind of became just like addressing society. Let me see. Thus, it has been during this last 6 months, which I have spent in the country by ordering me to spare my hearing as much as possible, my intelligent doctor almost fell in with my own present frame of mind, though sometimes I ran counter to it by yielding to my desire for companionship. But what a humiliation for me when someone standing next to me heard a flute in the distance and I heard nothing, or someone heard a shepherd singing and again I heard nothing. Such incidents drove me almost to despair. A little more of that, and I would have ended my life.
Right. And I mean, if you think about it, could there be anything worse for him than losing his hearing? I mean, this guy
Yeah.
is a musician. This would be like a surgeon who loses their hands or they get Parkinson's disease and they can't do surgery anymore. Um, so he was very despondent and he progressively lost that hearing until he finally became completely and utterly deaf at age 47. That's how old he was. But even in his early 30s, he knew that this was a very serious condition. And believe it or not, this was a very forward-thinking man. He ordered his own autopsy when he was about 31 or 32 years old. He said, I just want this autopsy someday when I die to figure out why this happened, which to me is remarkable because that autopsy was not a popular thing back then. In some ways, in
No.
some cultures, it was, yeah, exactly. It was taboo. And it was, you weren't supposed to be opening bodies and things like that. So
He
the
also
other thing
requested
about
that in
this,
that testament.
yeah, and that the other thing about it is this man wanted to have an autopsy knowing that he would never actually know the results. But he, because he would be dead, obviously. And yet he ordered it and it did happen. He did have an autopsy. And we're going to talk about that autopsy in a few minutes. But the hearing itself, the reason why it's important to use that as a starting point is that there are many conditions of which hearing loss is part of the constellation of symptoms. And that's where this stuff comes in about lead poisoning, Paget's disease, which can affect bones. So, like for instance, the bones in our ears can lose the ability to conduct sound. So that's why people brought up Paget's disease. And then there was something called Cogan's syndrome. I don't know if you saw that in the paper,
I
which is
did.
characterized by, yeah, by bilateral sensorineural neural hearing loss, interstitial keratitis, which is basically like an inflammation of the eye. Um, and let's see, what else did he have? So, and also associated with inflammatory bowel disease and arthritis. And so, a lot of people hang their hats on Cogan's. That's not a diagnosis I've ever made, but he does have all those symptoms. But I think it's sometimes easy to put all of these to pick out syndromes because there are many syndromes that affect multiple body systems. It is compelling, this Kogan syndrome, but there's still a lot of debate on this because he did have, in terms of some of his other symptoms, we talk about hearing, but he did have like inflammatory bowel type symptoms. He had recurrent abdominal pain his whole life. He had diarrhea, apparently, quite a lot. And so, you put that together, it does make sense. But what else was I going to say about this? I'm trying to go through all of his conditions that he had and then culminating with that autopsy. So we had the hearing loss is kind of the starting point, the watery diarrhea, the scleritis, or they say scleritis or interstitial keratitis. But he had another thing, which I personally, as a pathologist, found to be quite interesting. There was a description of him, and I'm going to read this description straight from the paper. It says that despite all of his symptoms, Beethoven had a robust physique. He was short with broad shoulders, had a short neck, a round nose, dark skin, and a wide and prominent forehead. So the key descriptor there that I'm interested in is dark skin. And I'm going to explain why in just a moment. But basically, this man, he had this wide, if you look at paintings of him, he has kind of that wide, big forehead. And that's where the Paget's disease comes in, because Paget's disease is a disease of bone remodeling. Okay. And so what happens is the bone gets thicker. And we're going to talk about the autopsy, like what the pathologist actually saw at autopsy. But because of that bone getting much thicker, that's what they think maybe why his forehead looked the way that it did. Now, the other thing is some people just have foreheads like that. Some people just have, kind of like prominent big foreheads, and that's not a disease. That's just how they look. So that could be the other thing. But the reason why the dark skin stood out to me is number one, you never see that in paintings, which I thought was kind of interesting. But number two, there is a condition that fits here that I don't hear people talk about a lot with Beethoven, and that is called hemochromatosis. Okay. Hemochromatosis is a disorder in which you have iron deposition in your body, in your tissues, and most prominently in your liver. Okay. You have this iron deposition, you get recurrent inflammation, which results in cirrhosis. Okay. Which he definitely had. But the other thing it does is when iron deposits in the skin becomes dark. And so, if you think about it, could it be that this iron deposition was occurring throughout his body, in his liver, in his pancreas, but also in his skin? And that would explain all his abdominal symptoms. That would explain his ascites. That would explain like his dark skin tone. Now, who knows? Maybe the guy liked to go tan. Maybe that's why he had darker skin. But Austrians, I don't know Central Europeans. I personally am a Central European descent, and we can sometimes get a little bit of dark skin if we go out into the sun a lot. But for me, I would put that higher on the diagnosis than something like Paget's disease. I just thought that was really interesting because I have never heard Beethoven being described as having dark skin. So I thought that was kind of cool. And did you read a book on this? Did you read a
I
book on
did.
him while we were
Yeah, it's called
preparing? Yeah.
Beethoven's Hair. And I'll post it. I'm just gonna start
Hmm.
making a book list of all the things that I'm reading because everybody really a lot of our listeners really love reading, which is great. So I promise I'll make like a book club, like a Knife After Death book club. But yeah, I read
Oh,
Beethoven's
I hope
Hair
I'm
by
invited.
yes, obviously. Beethoven's Hair by Russell Martin was the book that I was reading. I'm still currently reading it, but yeah, other than the autopsy report, and papers and all of that. I was reading that because they took a lock of his hair at his time of death, and that I'll let you kind of say what becomes of that.
This is where we get into the lead poisoning thing. So they took his hair, and I don't know all of the testing that they did on it, but I know that they collected that at the time of death. I don't know the exact historical because I didn't read that book, but I know I had read some papers on this a couple of years ago, and that I think that hair sort of went into the hands of multiple different people.
It did, yeah.
But one of the things they did was they tested for lead, and you can test for lead in hair. And they found, at least according to this paper, that his lead levels were 100 times what should be expected. Okay. Now, why would that be? Well, Beethoven liked to drink alcohol. Okay. That is not a secret. His grandfather was an alcoholic. His father was an alcoholic who actually died from drinking too much alcohol. And as we know, sometimes alcoholism does kind of run in families. So Beethoven, not only that, Beethoven had a lot of trauma as a child. Apparently, father was abusive. He had a number of siblings that died. His mother died of tuberculosis. His little brother died of tuberculosis. And by the time he was a teenager, Beethoven was drinking. And apparently he loved to drink specifically Hungarian wine. And from what I can understand, and by the way, I'm not a wine expert, so especially not an 1800s wine expert, um, Hungarian wine was sweetened with lead. Uh, and so I think it was leaded sugar or something like that.
Mm.
And for whatever reason, lead had a sweet taste to it. So he had this very sweet wine. Well, of course, he's drinking this. And what's it doing? It's depositing in the kidneys, it's depositing in throughout his body. Once you get lead in your body, it's pretty tough to get rid of it. And so that's why they think, and also, it can deposit in nerves. That's why you can have nerve conditions with lead poisoning, but also personality changes, cognition changes, things like that. So lead poisoning is one explanation, but my opinion of that is I do agree that that is a possibility, especially drinking out of lead goblets and things like that, along with the leaded wine. But I think lead is perhaps one explanation of his symptomatology. I don't think lead by itself can explain all of his symptoms, and I think the most cogent way to explain that is that a lot of people were drinking leaded wine back then. He wasn't the only one, and not everybody had these symptoms. So I think probably what you had is a guy with some chronic diseases of various systems who also had lead poisoning. That's my opinion on that. Um, and then trying to see as he gets older. Now, of course, all this time he's composing. This guy's unreal. In fact, as he's getting worse and worse, and his body is degenerating, and his stomach is getting larger because his liver's failing, and he's getting ascites. He's kind of not getting around very well. He's in bed, but he's still composing. He was still composing a symphony at the time of his death, which you'd love to hear that. You'd love to hear what he had going before the completion. But basically, this man was quite young. I mean, when he was in his late 40s to early 50s, he was really going downhill. He did pass away at the age of 56. We are going to talk about that autopsy here in a minute. But leading up to his death, um, I think the primary problem for him was this liver disease. And I have to explain a little bit about physiologically what happens with liver disease. So, as a forensic pathologist and also a hospital autopsy pathologist, I see a lot of end-stage liver disease.
Hmm.
These days, it's mostly alcohol. Yeah, it's mostly alcohol is the common factor, but also viral hepatitis. I don't see it causing cirrhosis as much these days. One of the theories, I think you were reading something about perhaps he had viral hepatitis was one of the theories. Is that
That
right?
was one of the theories, yeah. Viral hepatitis B.
Yeah, and so hepatitis B, hepatitis C, and some other hepatitis can cause cirrhosis. So I think that, and it's not unreasonable to think that he could have had hepatitis, viral hepatitis, but it's probably more likely that he had a like a chemical hepatitis, either from ethanol or my theory, which is that he had hemochromatosis. Um, so what happens is the liver becomes inflamed by whatever it is. Let's say it's a repeated injury with alcohol. I'm going to take this moment to remind people that alcohol is a cellular poison. It damages your cells, and that's why it's also a carcinogen. Well, liver cells, they have the tendency to regenerate when they get injured. Well, when they get injured repeatedly, they form regenerative nodules, and there's actually a little scarring. Well, when you get too much of that, we call that cirrhosis. And so that can happen with viruses, that can happen with autoimmune hepatitis, which is one of the other things they said about him that he could have had. Um, and of course, alcoholic liver disease is probably going to be the most common there. So when that happens, your liver, which is normally filtering blood from the, kind of the intestines and the lower part of your body, um, it loses the ability to filter as well. And because you've gone from a nice, soft, beautiful liver to now it's scarred. It's hard as a rock. It's like rubber, is what it feels like when you've got a cirrhosis liver. And what happens is it causes that blood to build back up in the portal system. The portal system is that's the portal vein is the main vein that goes to the liver, and you get this fluid which we call ascites, and basically it fills your belly. Okay, that's the non-medical description. But if you've ever seen somebody with liver cirrhosis, they can sometimes have that enormous abdomen. And that's because the abdomen is filled with what's called ascites or acidic fluid, ASCITIC, not acidic like pH. It's acidic fluid. Um, and that's problematic for a lot of reasons. It puts a lot of pressure on your blood vessels. Um, there's a lot of pressure backed up, which can cause bleeding in the esophagus. It can cause bleeding from the rectum. And also, one more thing on liver is that when you damage it enough, you have blood clotting disorder. And basically, in the sense that you start to bleed more easily. So, if you've ever seen somebody with cirrhosis or alcoholic liver disease, they a lot of times they will have bruises all over their body because very simple running into a countertop or running into a chair, you can get all of that really bad bruising. So that's what this guy was going through. That's what Beethoven was going through toward the end is his belly was increasing in size, his body was wasting away, and end-stage liver patients often have very thin arms and legs, but this giant abdomen. So that's what and also you got to understand at the same time he's also having this watery diarrhea, he's having joint pain, and he's deaf, but also has that horrible ringing in his ears. Um, so what does that do? It causes him to drink more because that's the only thing that can help him feel a little bit better. But he also took a lot of what would basically be like aspirin, these days. Cialicin, I think, is what they were saying. His brother was a pharmacist, apparently, his one living brother, and they think may have been giving him a lot of medication to make him feel better in terms of like pain or discomfort, which later possibly explains his kidney findings, which we're going to talk about when we get to the autopsy. But basically, you've got the hearing stuff, which didn't kill him by any means, but now you've got the liver problem and the GI problem, which now you're getting into a situation where now you're going down the path of death, and that's where he was for the last few years of his life. Um, I can. Did you have anything to add there?
Yeah, I actually, so there's
Yes,
a
ma'am.
another quote that I had from the Heiligenstadt Testament. Um, so it kind of, such as we all do, like when we're going through things, I kind of swing wildly back and forth between very hopeful moments and then also despairing. I think that's just the human condition. But to two of his friends in that letter he'd written, because he was like now in a more determined state to just try to like embrace, you know, his conditions, let it kind of fuel his compositions and his art. So he puts in here, seize fate by the throat, it shall certainly not crush me completely. And then in 1806, Beethoven noted on one of his musical sketches, let your deafness no longer be a secret, even in art. And so he kind of started letting it fuel him in a lot of ways, which I found to be, I mean, that's what art is supposed to do. So I loved
Well,
that little piece there.
exactly. And so I think it's a good lesson because with Beethoven, this is a man who was suffering daily. And so he made the
Profusely.
choice, right? He made the choice. Do I sit? Do I languish in my suffering or do I channel it into my art? And of course, produce some of the most incredible music of all time. Hundreds of years from now, when we are gone, they will still point to Beethoven and musicians like him. So he channeled his basically suffering and disease into art. And made beautiful music, though. It wasn't grim and dark and funeral dirges and things like that. I mean, he was suffering, but made this incredibly beautiful music, which I think is really amazing. It's kind of strange that maybe they haven't made a really good biopic about him, at least not one that I've seen.
Right.
Um, but I want to get now down to the final moments, kind of like the final, let's say, year or so, leading up to Beethoven's death. And then we'll talk a little bit about the autopsy, which was a very brief report. I mean, it's not like a regular autopsy report. Um, but in the last year, he was starting to bleed more. He had nausea, vomiting, abdominal pain. He had jaundice, so he had visibly turning yellow at this point, which is sort of the when you get to the end stage liver. His bleeding was thought to be probably related to low platelets, secondary to his liver dysfunction. Um, and obviously, if you're bleeding a lot, you're going to become anemic as well. So he's feeling bad from that. He also went into altered mental status from what they think was probably hepatic encephalopathy. So let me explain that a little bit. As an aside, when I was a third year medical student, my very first patient on my clinical wards, internal medicine, the first day of medical school, was a hepatic encephalopathy patient. So, being a good medical student, I went nuts and I memorized the whole thing. I read every single thing on it, and I became a hepatic encephalopathy like legend because I wanted to be good on my wards. And by the way, if there are any medical students listening to this, that's how I recommend you get good. When you see a disease on your wards, you see a disease in your patient, find time later to get out the books. Do people even read books nowadays? It's probably on an iPad and read the actual everything you can read about the disease, and it will click in every time you go see that patient. You'll learn more and more about it. So what happens is with the cirrhosis, you get a buildup of ammonia in the blood, and your brain does not like that chemical in your bloodstream. And what happens is it causes an altered mental status. The patient that I saw, and it doesn't sound like he was this bad at this point, but the patient I saw was completely obtunded, meaning he was just sort of like grunting and not responsive to any sort of like stimuli. And what happens is you got to give him a medication that lowers the ammonia level. And a couple days later, I saw the guy on the wards, and he was doing great. He was actually talking to me and answering questions. So this sort of thing can be taken care of these days, but back then there would have been really nothing that you could do except just probably avoid things that would increase the ammonia level, things like high protein.
Makes
Um,
me wonder how they would
so
try to like help
yeah,
with ascites too, because I know that obviously like procedures that you can do to help relieve that and drain the fluid. But I
exactly.
mean, back then I don't know what that would
So
have been.
well, they actually did, and got to the point where it was what they call a tense abdomen. And let me tell you, as a person who has seen many patients with cirrhosis, when you touch the abdomen, when they are completely full of ascites, it is like touching a marble countertop. It
Hmm.
is as hard as a rock. And so they are extremely uncomfortable. So they do what's called a paracentesis.
There we go.
And in
That
fact,
was
my
my bad.
guy in my third year of my first patient, yeah, he had a multiple paracenteses while I was there, and the amount of fluid that drains off is actually remarkable. The most I have ever seen at autopsy in one fell swoop is 7 liters of acidic fluid from a patient with liver failure. So
That's
7 liters,
insane.
you can imagine, right? You can imagine 3 2-liter bottles of soda and then another half. And that's how much I got out of his abdomen. Now, get this. They did this 4 times for Beethoven, and he had 22 liters of ascites that was drained. Okay. So he's getting, on an average, over 5 liters out of his abdomen every time they do it. This is an enormous amount of fluid and very uncomfortable. And so this guy's pretty much laying around. But here's what the key with this. And I believe that this is probably what put him on the path to death is that back then surgeries weren't really sterile. You did surgery and you hoped they didn't get an infection, but they've almost always got an infection, and so at that point it's up to their body to kind of fight that infection off. Well, you've got a man here who's got so many chronic diseases, he has a little trouble probably with his immune system. So they did the paracentesis surgically, which probably means they took a scalpel, they took they made an incision into the abdominal wall, which generally is not very thick in patients who have liver failure because they're not really fat. Their abdominal wall fat thickness is actually very small. So it's probably a small incision and then it just pours out. Well, what's the problem there? If you're not doing it sterile, now you've introduced bacteria into that wound, which can have a channel down into the abdominal cavity. And so what happened with Mr. Beethoven here is that I believe it sounds like he had bacterial peritonitis. Um, and I will talk about the evidence in the autopsy of why we think that, why other experts think that. But he gets, despite all this, while he's doing this, this man is eating and drinking like he's, just having a great time. He's not even losing his appetite. And so I thought that was kind of interesting that he's getting all this fluid drained off and he's just like, hey, bring me my food, bring me my drink. He was still doing okay. Yeah, I know. He's probably drinking all that lead wine too to make himself feel better. And he was still composing at this time while he's, sort of on his deathbed. But then finally, March of 1827 is when it really went south. And he had really bad jaundice at this point. So he's bright yellow. He once again has tense ascites. That's again very hard abdomen. He has lower extremity edema. And if you read the autopsy report, they use the phrase, they use the word dropsy,
Hmm.
which what that means is the edema of the body, the edema of the lower extremities that happens when you lose so much protein. Your protein is so low that you actually get this fluid that's kind of excessively going into the tissues. And he then developed inuria, which means he's not producing urine anymore, fever, and once again, hepatic encephalopathy. So, fever concerning here for an infection. And I think that, and I'm going to talk about the autopsy in just a second, and I'll explain how all of this fits together. So, Beethoven dies, and they do an autopsy, and interestingly, I found this to be one of the most interesting things is that he was autopsied by a guy named Dr. Johann. Of course, Americans will say Wagner, but it was Wagner is how
Wagner.
you're going to pronounce that. And yeah, yeah, but not Wagner the composer. It was not that Wagner. And we had uh, who worked with Karl von Rokitansky. Now that name, who's if you're listening to this and you're not in pathology, you're probably like, oh, okay, thanks for telling me that. But if you are in pathology, that name is a massive, massive name in the field of
Hmm.
medicine and the field of pathology. Karl von Rokitansky is the man who basically, and I'll have people jump in the comments and say that I'm wrong about this, but he is the man that basically kind of like modernized the way that we do autopsies. It's been done the same for the last couple hundred years. Rokitansky himself did something like 60,000 autopsies by himself. If you think about that number, that is insane. Now, again, I'll have somebody come in the comments. They'll say, no, it was 65,000. You're wrong, and I'm better than you. But you have to understand, this man did more autopsies than anybody on the planet, for sure. So the fact that Rokitansky was able, with Wagner, to kind of, do this case, um, the results are going to be as good as you can imagine at the time. It's not
Hmm.
just some random country doctor with a knife that just went and cut Beethoven open. I mean, he had qualified people. Um, Central Europe was
Extraordinarily
kind of the
qualified.
epicenter. Yeah, Central Europe was kind of the epicenter of all this great breakthroughs in anatomy and medicine from the 1500s on. And so this autopsy but was actually very short. Back then, let me explain. Today, autopsy reports can be quite long. My autopsy reports are as succinct as you can possibly find, and they're about 5 to 6 pages. An autopsy report that's very detailed might be 20 pages. Certainly, the Greenberg case we did, I think that one was 20 something pages,
32.
autopsy. Yeah, there you go. And so, of course, the difference is she had a ton of wounds. This guy didn't really have any wounds. His was a medical case, but this was basically a one-page autopsy report. And I want to talk kind of about some of the text in that report. So he was described as being emaciated, which is what I mean by having thin limbs. His musculature was basically wasting away, um, and particularly of the lower limbs with multiple petechiae. Now, petechiae refers to hemorrhages within the skin, and I'll tell you that petechiae, the way that we use it these days is that it means pinpoint hemorrhages. So like tiny little pinpoint hemorrhages on the skin. But from what I understand, back then when they used the term petechiae, they actually were referring to the what we call an ecchymosis, which is kind of like a bruise. So a bigger, splotchy looking hemorrhage or like a bruise, which is extremely common with people with end-stage liver disease. His abdomen was distended. And then here's a really key phrase. The abdominal cavity was filled with turbid, grayish brown fluid. Okay, so let's stop for a second. Peritoneal fluid, or even regular ascites, which is an increase in peritoneal fluid, is a yellow amber color and it's as clear as water. That's how you know it's not infected. Turbid, grayish brown, that means turbid means thick. You can't, light doesn't pass through it. It's gray brown. This is evidence. It's not just evidence, it is diagnostic of acute bacterial peritonitis. So, in other words, he gets inflammation secondary to bacterial infection within that big tub of acidic fluid in his abdomen. This is still a common cause of death today. So, what happens is you get so much overwhelming infection in your abdomen that you become septic. And so, I believe that uh, he became septic secondary to acute bacterial peritonitis. And that's ultimately what causes death. So, for instance, when you go back, he had fever. Okay, that favors an infection. He also had anuria. Anuria means not producing urine. And what that is significant for is that is a organ failure. So he had acute kidney failure. And so when you have multi-organ failure and you have an infection like this is diagnostic basically for sepsis. So that's going to be like his most uh, uh, close to his death cause of death. I guess you would maybe say it for people who are lay persons, is that the incision secondary to a paracentesis becomes infected and he dies. But the way that we do cause of death is what caused that acidic fluid to begin with, and that is the cirrhosis, the end stage liver disease. So then you can take it a step further. And if you know what caused the cirrhosis, that's the cause of death. So I see this in my own practice. If you've got a person who dies from, liver disease like this, but you know that they had, let's say, chronic hepatitis C infection, then you can say complications of chronic hepatitis C infection. You don't actually say cirrhosis. It's a chain of events. The viral infection caused the cirrhosis, which then caused the ascites, which then caused the infection. Because, by the way, they can become infected even without surgery. We call that spontaneous bacterial peritonitis. So, going on with the autopsy is that his liver was half its normal size, hard and bluish green with a nodular surface. Okay, so let's break that down. Some people think that liver disease from alcohol or whatever will cause an enlarged liver. And the truth is, it will sometimes enlarge earlier in the process of the disease. If I autopsy somebody who is an alcoholic, but they are not yet cirrhotic, the liver is absolutely enormous. It might be 3,000, 4,000, 5,000 grams. A normal liver is usually about 1,600, 1,800 grams. But after it becomes scarred, secondary to cirrhosis, the liver starts to shrink. And it becomes, like I described it earlier, the consistency of a rubber tire. In fact, when you cut it, it'll start to dull your blade very easily.
Oh yeah, yeah.
So why is it bluish? Yeah,
Yeah,
and
normally it
go
slices
ahead.
like butter, but yeah,
Oh yeah.
completely changes the texture, like everything about it.
Yeah, you can take a little scalpel with a fresh liver, and it's just like if, and I personally don't eat liver, but I know that some people do eat liver. It's exactly the same consistency for people who maybe are out there and eat liver. It's very soft. You can take a scalpel and just cut through it. It doesn't make a sound or anything. But with a cirrhosis liver, it will dull your blade. You have to put a lot of force into it when you're cutting, and you can actually hear it because it's like you're kind of ripping through almost rubber. And it's like that because there's so much scarring, and scarring is fibrosis, and fibrosis is made of collagen. Okay, and collagen is tough. So I also want to say that they described it as bluish green, and that's a really nasty liver because that means the bile isn't even getting out into the gallbladder. The liver is so scarred that the bile is trapped in those little tiny bile ducts within the liver. And when you get a lot of bile back up, it turns green and it turns kind of a bluish green color. The other explanation for that is the man had bacteria in his abdomen, and there are some bacterial species which can produce a blue-green color as it grows. I suspect this was bile staining, though, and not necessarily due to uh, bacteria, although it was there clearly. And then the nodular surface is important because that's the diagnostic feature of cirrhosis, is that nodular surface. Now, interestingly, and I want to get a little bit, this is heavy into the pathology here, is that there are two types of cirrhosis. One is called macronodular, which means large nodules, and one is called micronodular, which of course means small nodules. Now, interestingly, a lot of people say that Beethoven had this alcoholic stuff due to, or sorry, this cirrhosis due to alcoholic uh, abuse. However, alcohol related cirrhosis tends to be micronodular. His liver was macronodular. So that's why, I mean, I do think alcohol was a part of his liver disease, but I don't think it was the only explanation for his liver disease. I think you could have a viral hepatitis, could possibly have an autoimmune hepatitis or a sclerosing cholangitis. And then, of course, alcohol. But then coming back to the Dr. Wolf theory is the hemochromatosis, the liver having iron deposition in it. I think it was a mixed etiology cirrhosis. And when that happens, you would call cause of death something like end-stage liver disease because you're not sure exactly what caused it. So I thought that was really cool. The spleen was enlarged, which makes sense because what happens is, and again, I like getting specific because I know some of our listeners are doctors or medical students. Some of our listeners just they don't have medical training, but they want to learn. And what happens is the portal vein in the abdomen, it's right under the liver. It splits off, and there's a branch called the splenic vein. And as you can guess from the name, it goes to the spleen. So what happens is since the liver is not filtering the blood very well, it backs up. And it backs up just like a pipe were to back up in your house if it gets clogged. And that blood backs up into the spleen through the splenic vein and it enlarges the spleen. And that's what happened here. So he has a very textbook case of cirrhosis. Um, Continuing on, now, the kidneys, interestingly, like his heart and lungs, they didn't really have much to say about his heart and lungs. I didn't see really anything about his brain, but they did say his kidney was full of concretions. Okay, so there was like
Hmm.
stones in his kidneys, and they called it a calcareous concretion, which is a nice alliteration. Um, and but they don't know exactly what caused this, and the diagnosis is one of two things. One is kidney stones, which very well could be, but the other is papillary necrosis. And so, without knowing a lot about the kidney, if you don't know a lot about the kidney has these little triangular areas, or sort of pyramidal areas called papillae. And what happens is those can become necrotic, which means they die. So, what causes papillary necrosis? Well, there's a number of things that cause papillary necrosis. One of which can be diabetes. So he very well could have had diabetes, especially with all that sugar wine he was drinking, and also analgesic abuse. So taking too much painkiller can cause papillary necrosis. And that's where people came in and said, well, I wonder if that's one of the problems he had is that he was taking too much of that pain medication and it was actually killing off his kidneys. Um, and it could just be kind of the end effect of his sepsis, where he has the end stage renal, his kidneys are just dying. So, we don't have the microscopic slides from 200 years ago because they weren't making them 250 years ago. But boy, that would be interesting to look at if they
It
did.
really would be.
Um, yeah, yeah. That practice didn't come in until. And again, here's one of these things where somebody will say, "Well, actually, doctor," which, by the way, is the most annoying thing about having any kind of presence online, because I don't prepare for these very much. I basically just talk off the top of my head. So sometimes there are details that aren't exactly correct, but it's about 150 years ago, I think, is when they started making glass slides and pathologists started looking under the microscope at things. So that would have been Beethoven's death would have been well before that. A couple of other things I wanted to say about this is he had a very firm, hard pancreas. So, what does that mean? Well, that is suggestive of chronic pancreatitis. Chronic pancreatitis also occurs with chronic alcohol abuse. And what happens is you get recurrent inflammation. And what happens after inflammation? You get a little bit of scarring. Little bit of scarring, you get fibrosis, and the organ becomes more firm. So in a way, it is like what happens to the liver. But it's an inflammatory process that becomes scarred, which if you think about it, you do that enough and you're going to develop diabetes because you're going to kill off all of your islet cells, which produce insulin. So I think that this man very well could have had diabetes as well. Um, Impossible to prove, but you go through the abdomen and basically all his organs have some kind of very serious pathology.
Yeah.
Um, and then this paper that I read didn't have a ton about the brain findings. But one thing I found interesting, and I don't know if you have more stuff on the brain from your side, because I think we had some different sources that you and I were both
Mainly just
looking
the
at.
skull.
Uh, yeah, exactly. So the skull was very thick, and it's hard enough to open a skull now if you don't have a really sharp, good brand new blade on a saw. I can't imagine what it must have been like back then because they had to use a hand saw to get through there. So the skull was thickened, but interestingly, I saw a couple of different interpretations of what the brain looked like. They were saying that there was atrophy of some of the cranial nerves, and by the way, the vestibular nerve within the ear, which is cranial nerve 8, is what allows us to have our hearing. And that's what went wrong for him. He had, obvious hearing loss secondary to nerve damage in the inner ear bilaterally. We call that cranial nerve 8 or the vestibular nerve. And I saw a couple of different explanations. One is that the nerves were atrophic, which means they're kind of withered away. But then I saw another one that said they were enlarged, that the nerves were actually enlarged. And I find that interesting because there's not a great explanation for why his nerves would be enlarged if he's going deaf, except that you can have tumors of the vestibular nerves, basically neurofibromas. And if you have a genetic disease called neurofibromatosis, I believe type 2 is the one where you can get the bilateral um, tumors there. So, I mean, I did at least think for a second when I read this, could this man have had that? I had a young man when I was in a medical school. He flew in to the United States from another country. I think he was from somewhere in South America because he was a young man. He was like in his 20s, and he had bilateral tumors of cranial nerve 8. And neurosurgeon was going to go in and try to take those out. And so it did make me think about that. Could Beethoven have been like that young man that I saw, and he had a bilateral tumor of cranial nerve 8, and that's what caused his hearing loss? Um, Certainly, there are diseases that have multiple areas of the body, and these are genetic diseases that can affect multiple areas of the body. But the bottom line here is all of this together, all of this stuff that we've talked about, nobody can decide exactly what happened to Beethoven in terms of his medical history. I mean, we know his medical history, but even the autopsy it didn't give a definitive diagnosis. And uh, certainly back then, what was their ability to diagnose? That's the other thing. There were a lot of diseases that hadn't really been described yet. So when they did autopsies back then, they were just being descriptive mostly. They were just making their observations, and hopefully someday somebody can figure it out, maybe. Well, here we are 250 years later, 250 plus actually, after his death, and all of us pathologists and neurologists and other types of doctors, we still don't know exactly what Beethoven's problem was and all of his underlying disease. So
Actually,
it's
I
an
have
interesting case.
that in the testament too. You, my brothers, as soon as I am dead, if Dr. Schmidt is still alive, ask him in my name to describe my malady and attach this written document to his account of my illness, so that so far as it is possible, at least the world may become reconciled to me after my death. So, I mean, and like we said,
Yeah.
autopsy was taboo. And when I say taboo, I mean it was used as capital punishment. Public dissection was to
Mhm.
humiliate somebody for crimes. So, I mean, it's just the fact that he had the wherewithal, and he didn't know that he was going to get like one of the kings of autopsy to,
Yeah.
perform his. But he requested his own autopsy, and yeah, was just
For
kind of,
me, that's the most amazing thing about this. Yeah,
yes,
that's the
yeah,
most amazing thing about
yeah,
this story is that the guy requests his own autopsy 25 years before he dies.
yeah.
That is remarkable, you know. And the fact is, none of us can figure it out. We can have theories, but
Hmm.
none of us can prove it without actually seeing the body, being able to examine tissues under the microscope, things like that. And that's just not possible.
Yeah.
That's just not possible this far out. So we're left with theory, and it definitely makes me think of my most difficult cases. Like sometimes I go to the hospital and I come in to do the autopsy, and I'll have a chart that's half a foot thick of medical records. And you go to the past medical history and the past surgical history, and it's just dozens upon dozens of diagnoses. You do the autopsy, you find some kind of malady in every single organ, and then you're left with trying to explain what happened.
Hmm.
And those are the most difficult cases. So it's not surprising at all to me that they really couldn't know exactly why he died. And today, again, 250 something years later, we still don't know exactly. or actually maybe is it 200 or 250? I don't know, but we don't know exactly why this man died. And so it's just incredible. I think it's 250 from his birth, but it's almost 200 from his death. That's what it is, I think. Is that
And
right?
also to bring up, there's a very
Because
famous phrase in Latin that pathologists and pathology people all kind of geek out over, and it's Mortui Vivos Docent, which is Latin for the dead teach the living. It's been in morgues that I've gone to. Like it's in one of the morgues I worked in, it was like displayed on the back wall. And just from kind of like you were saying, just thinking about your own tough cases. This wasn't necessarily a tough case in the sense that this was not a lot of pathology. This was a tragic accident in which a very young man drowned. And up until his death and being a part of his autopsy, being the autopsy technician for the doctor that was, you know, figuring out what happened to him, I had never seen what a healthy liver looked like in a person because I live in an area where alcoholism is like the norm for people to die, drug addiction, all of that. So by the time I see them, you know, I don't have really a point of reference for what a liver is supposed to look like for comparative analysis. So like just with that
Mhm.
phrase Mortui Vivos Docent, I'm always very thankful to him because unfortunately he did drown, so the pathology was in his lungs, but he was the first person that I ever got to actually see what a liver should look like.
Yeah. And that's exactly, I mean, it's kind of the same spirit of what Beethoven did. I mean,
Exactly.
he knew that he wasn't gonna know his own diagnosis, but he was thinking ahead. I want somebody else to maybe benefit from this. And sometimes people have that foresight, and other times it's up to us as the pathology team to learn what is happening, and then we become enriched by that, and then we pass that back on to the community. That's
Exactly.
why we see the diseases, we see the accidents, we see things like homicide or suicide, and we can talk about those things and say, let's try to prevent those. That's actually one of my favorite things about this job is that I'm able to directly interface with the public and say, here's what I'm seeing. In fact, one of the things, and we might do this as a podcast, we may or may not. I know I'm certainly going to put it on some of my social media, is I've tabulated all of my data for 2025, my autopsies, and I'm going to go through and talk about what was most common and what was most unusual and all of my breakdown percentage for manners of death and all of the different causes of death I had. So we may or may not do that as a podcast, but I certainly look out for that because I'm going to be talking about that data soon. And that's how, for instance, you're going to learn from me. I learned from these bodies, and then I'm going to aggregate that and then deliver it back to you, hopefully for easy consumption. Um, so yeah, that's the case. That's the case of Beethoven. I mean, there's actually a lot more to this case. We could talk forever on this one. We could talk for 3 hours, 4 hours on this case, talking about his life and how he was balancing his sickness and his life and producing all these amazing pieces. But ultimately, we just wanted to kind of do an overview of the pathology here. Please let us know if you have any questions or comments. I know that people always will have comments. Um, but they're always gonna. I'm sure I mispronounced something, and then people will say, you got that wrong. That's not how we pronounce it in my country. So I don't typically do pronunciations for all 200 plus countries in the world for every word. So, yeah. Anyway, so yeah, that's the case, and I don't think there's really anything else we need to cover on this one. But certainly, please give us your questions or comments, and we will hopefully be back soon. I'm just happy that I got through this thing without coughing like a crazy person because
I'm
I have
thrilled
been
for you.
coughing for well, thank you again, Halls, if you want to sponsor us. I had a Halls right before I started, and I did well tonight. I told Jesse before we started that I could maybe go an hour or so, and then I would have to terminate. So I think we're around that hour,
hmm
and I think the water helped too. I have my water here that's I've been able to keep myself from coughing. But you should have seen me in Autopsy today, or heard me. I was just coughing the entire time, and it was driving me nuts, and I think it was driving other people nuts. But thankfully, I
I
was
feel
wearing an
so bad for you
N95, and
because
I'm not.
I
Yeah,
feel so bad for you because I've done autopsies sick before, and when you're in an N95
yeah.
dissecting
Oh, yeah,
somebody,
it's worse.
that's oh my God,
Yeah.
I'm so sorry. It's the worst.
Well, the thing is, I'm really mad about it because I have been blessed with a very healthy adulthood. As a child, I was as sick as Beethoven, but as I became an adult, I really hardly ever get sick. I think I've had maybe two respiratory infections in the last 6 years, and so for me to have this and continue to cough, it is unusual and it is very annoying, but it is what it is. So I think with that, we'll wrap up and we will, hopefully you enjoyed it. And we'll see you next time. Jesse and I are always brainstorming on topics for which to talk about. But certainly if you have something you want to hear about, you can write us. Let me go ahead and if I forget anything, Jesse, please let me know. But our social media, we're both at Instagram, and there's our personal pages, but there's also the Knife After Death page at Instagram. I am at Substack, Dr. Darren Wolf. You can go there, and my Substack is where I actually show autopsy photos and videos because it's the only place that doesn't censor me. I will
Yeah.
tell you that those images are typically behind a paywall. I do actually have a subscription there if you want to come and support Dr. Wolf. The YouTube Knife After Death, which is where this one airs. Of course, our podcast, the audio version is everywhere that Jesse puts it up. And what did I forget? Oh yeah, TikTok. That's the one where I have like 1 million followers. How can I forget? I can forget. I have like 1 million, almost 1 million over there, but almost no one sees my videos, so it's kind of worthless. But yeah, over there, my name is. It's just you can type in the dead letter, or you can type in Dr. Wolf, pathologist, and I think I'll come up either way. So yeah, did I forget anything? Does that cover all of our socials?
Yeah, that covers all the socials. And then, like I said, I'll link all of like the any photos that I post that kind of go with the episode, unless we display them like in a presentation here. I post them on our Instagram so they correspond with the episodes, and then I will try as hard as I can to make sure any movie titles or any books, especially books, that we discuss, I'll link them in the show notes, but then I'll also post pictures of them so you guys can pretty easily find them.
Yes, that's a great idea. Do that, and also for is if we can get away with it at Instagram, it would be cool to see a cirrhosis example
Oh,
for the
absolutely. Yeah,
people
that's
to
for sure.
yeah, and
Yeah.
and I would maybe also throw in a renal papillary necrosis and possibly a Paget's disease of bone,
Hmm.
if you can get away with it. Instagram is probably our worst one about censorship, which is why if you go to my Instagram, there's not. It's picture. The last few have just been like pictures and videos of me, which is
I've
it's
kind
not
of
as cool
cracked
as
the code on
pathology,
that
but
one, because they don't,
yeah.
when I post art first, they don't censor me. So we've
Ah,
had no issues at Knife After Death, so you should be able to find it. But and luckily, like, Doc and I love art anyway, so I basically like sneaky usher it in. So you'll see pictures of
ah,
art, those kinds of things first that we've discussed. You'll probably see a painting of Beethoven, and then once you scroll past,
I like that.
yeah, that's how I that's how I
I like that. I think
sneaky.
that's a good way to start it. Is you could have Beethoven there, and then after that we can have a couple of those conditions, just so people can have a little example, and if they want to look up more, read more, they can
I
do that.
Trojan horse
But anyway,
pathology at this podcast.
I love it. I mean, you got to do what you got to do because it's hard to get our message out, even though it's really helpful, and I think a lot of people could learn and society can benefit. We have a tough time with censorship,
We
but if
do.
you want
We're
to see
the
some good stuff,
resurrection
go
men
to
of
my Substack.
2026.
It's definitely true. All right then. Well, thanks and good night, and we will see you next time.